So in this role of clinical documentation specialist, is there room for growth?
Yes, there is, luckily. Um, a lot of these CDSs will go on to managerial positions further up the chain. So you can be, for example, a group leader. So you're managing over a group of clinical documentation specialists. You can move up to higher managerial positions that in the realm of basically administrative positions within a hospital system. So it's mostly like inpatient CDI at the moment, but the outpatient world is growing as well, and I'm sure there are positions growing there too. So a lot of my directors started off as clinical documentation specialists, and now they are part of the hiring process for clinicians, and they take a huge role in the hospital setting, and they're kind of just under the C-suite. So there's definitely a lot of room for growth if you want to pursue that.
Where do you see yourself in 5 years?
Well, fingers crossed, I'm getting a master's in public health at the George Washington University. And I'd like to finish that degree. I've kind of been delaying it for the time being because I've been moving. It's my chaotic background. But I see myself, I'm getting emphasis in health analytics. So I see myself in a role in which I am integrating billing and coding that I've learned in the CDI world, and I'm integrating that into the public health world. So I'd like to use my love of computers and strange love of statistics and data analytics that not many people share. And I can actually use that to improve the medical world and improve public health. So there's a lot of health information management and public health jobs that are associated with that. But I think I'm always going to be very involved in advocacy, and particularly through writing and just trying to educate people who are not in the medical world as to how the medical world works, because I feel like there's very much kind of a disconnect there. And I just always want to help with that growth and understanding. So probably something pretty similar to the job that I have right now, but I think something a lot more far reaching and something that gives me a sense of fulfillment. So